Hi everyone, this is Judy. Today we're going to talk about patient-related workplace violence against nurses in healthcare setting. Firstly, what is workplace violence and the significance of workplace violence? Patient-related workplace violence against nurses has become a critical issue in contemporary healthcare system. Workplace violence are defined as any intentional, physical or non-physical acts in which the victims can be abused, harassed, threatened, or assaulted, and often may result in physical or psychological harm of the victims. A high incidence of workplace violence in healthcare settings has been reported all over the world. Some of the common causes of workplace violence include failure in communication, delay of the service, high stress, and contacts with aggressive individuals. So, what are the impacts of workplace violence? Short and long-term exposure to workplace violence can potentially lead to serious adverse impacts on personal safety, physical and psychological well-being of the nurse and the patients. Common harms associated with workplace violence include physical injuries, sleeping disorder, anxiety, mental stress, fear, reduced job satisfaction and motivation, as well as disruption of daily activities and nursing care, which in turn may also affect the quality of patient care and placing patients at risk of unnecessary harms. So, what's currently being done about workplace violence? Significant resources were developed and implemented to prevent and manage the adverse impacts of workplace violence, such as zero tolerance policies, local violence incident report systems, and aggression management teams, violence prevention and management training program, as well as violence risk assessment too. So, what are the concepts and skills relevant to effective leadership, and how does this contribute to resolving or mitigating workplace violence? Effect, um, Effective leadership is essential in mentoring and supporting the team members to prevent and manage workplace violence appropriately to ensure safe workplace. This can be achieved through provision of effective staff education and ensure effective collaboration and teamwork. Provision of effective education is vital to increase staff awareness and understanding about workplace violence, and therefore staff can be able to respond promptly and appropriately to manage workplace violence incidents. One study shows that effective staff education in identifying risk behaviors, education, and de-escalation, as well as violence management can help to reduce the incidence of workplace violence. Leaders have the duty to ensure that the staff understand the risk factors for violence and adhere to zero tolerance policies. And leaders must also help staff to recognize the threats by undertaking comprehensive risk assessment and helping staff to understand the relevant safety management strategies such as breakaway and call for backup and communication techniques such as empathy and negotiation, as well as encourage incident reporting. According to zero tolerance policies, consultation with relevant staff is mandatory in all stages of risk assessment process, and appropriate actions and plans of care must need to be developed in consultation with relevant staff and other stakeholders. As a result, effective collaboration and teamwork are essential to ensure appropriate consultation process in order to prevent and mitigate negative effects of workplace violence, as well as broaden the possibility to meet the complex needs. Leaders can support effective teamwork in many ways. For example, leaders must communicate effectively within the team to ensure the issues were addressed appropriately, engage staff and their stakeholders in appropriate and safe plan, Ensure staff were informed of and understand the management plan and able to implement the plan appropriately, as well as assessing the effectiveness of the plan. So, what's my responsibilities as a new grad nurse in violence incidents? As a new grad nurse, it's essential to understand your responsibility in preventing workplace violence from happening and understanding how to minimize and manage the risk to ensure safety of self and others. As a new grad nurse, it's essential to understand and be compliant with policy addressing workplace violence, particularly zero tolerance policy, as lack of and non-compliance with policy is one of the common causes of workplace violence. According to zero tolerance policies, nurses need to be able to recognize, assess, manage, or eliminate risk related to workplace violence by conducting standard procedures, particularly risk assessment and management approach and violence incident reporting. The assessment outlines 5 standard steps, including establishing the context, violence hazard identification, assess the violence risk, control the risk, and lastly, monitor and review risks and controls. As a new grad nurse, it's your responsibility to support effective prevention and management of violence incidents by consulting with relevant staffs in all stages of the procedures to ensure comprehensive and appropriate actions can be planned. Calling for backup and supports when you feel unsafe at any time, as well as working collaboratively with the team members. Firstly, the new grad nurse has the responsibility to understand the context. For example, who are the stakeholders and what kind of workplace is it? Secondly, the new grad nurse needs to be able to recognize and be aware of risk factors of potential violence and factors which may trigger or escalate aggressive behavior, such as environmental factors, for example, settings like emergency department, ICU, long waiting time, and heavy workload. Organizational factors, for example, like ineffective teamwork and lack of aggression management, as well as other factors including alcohol and drug affected, psychological impacts, and medical conditions. In addition, the nurse also has the responsibility to evaluate these risk factors and the underlying causes of violence. Thirdly, the violence risk must need to be assessed to determine the severity of the risk in order to plan and prioritize appropriately. To assess the risks, the nurse needs to consider factors such as the range of the impacts and level of exposure. Fourthly, appropriate interventions and management strategies must need to be developed in consultation with all relevant staffs, including employees, students, and volunteers. In a more complex situation, safety experts and security staff must need to be consulted. Some of the methods may include cold black or gray responses, control access, isolates the hazard from people, and short waiting time. Lastly, the effectiveness of controls must need to be reviewed. Additionally, the nurse has the responsibility to advise any other potential risks, as well as reporting the incidents of violence through INS to assist the development of relevant violence prevention programs. Overall, effective staff training and education, as well as team collaboration, are essential to prevent and manage workplace violence incidents. Leaders need to ensure that the staff understand the process to recognize the risk factors and the risk behaviors, relevant communication techniques, and the violence management strategy through staff education and training. Leaders also need to support effective teamwork by ensuring clear communication in all stages. And lastly, as a new grad nurse, it's crucial to be in compliance with policies addressing workplace violence by following risk assessment and management process and incident reporting appropriately to support effective prevention and management of workplace violence. Thank you for listening.